Good evening, everyone. Good evening and a special greeting to our Lupus warriors and an even more special welcome to the children and the youth online. Happy Lupus Awareness Month. We salute you. This is all about you this evening. Welcome to our special edition of Ask the Expert Live in celebration of Lupus Awareness Month 2021, in celebration of you. The theme is Children and Youth with Lupus, saving lives through knowledge and support. Now, as many of you may know, as many as 20% of those living with lupus are actually children and young people. Now, because the focus is children and the youth, our special guest is a pediatric nephrologist, Dr. Rebecca Thomas-Chen, and I'll introduce her in a few minutes. So call your family, call your friends, call your teachers, call your coworkers, because we are live streaming and we want to hear from you. Like and share the video now and subscribe to the channel, because we are now live on our YouTube and Facebook pages. On Facebook and Instagram, you can follow us, follow the Lupus Foundation social media handle at Lupus Foundation Jamaica. So parents, children, youth, teachers, tonight you can have all your questions about lupus and specifically lupus kidney disease answered. So this is how you'll submit your questions live. You can type your questions in the YouTube and the Facebook chat during the show, and we will read them. Of course, we have quite a number of questions that came in before the show. So call everyone, this is for you, specially put together. It's a special 1 hour, not the usual monthly, half an hour, a whole hour just for you. So let me tell you, I'm Tanisha McGee, and I'm a rheumatologist, and it is my pleasure to host. And it's an even greater pleasure to have an expert who will answer all your questions, because it's very uncommon that we have someone who is not just a kidney specialist, but also a pediatrician who will be answering your questions. So it's my great pleasure to introduce to you our speaker this evening. She has a Bachelor's of Medicine, Bachelor of Surgery, that's the MBBS, at the University of the West Indies, Mona, where she studied, and a Doctor of Medicine in Pediatrics. And having developed an interest in pediatric nephrology during her pediatric training, she went on to McGill University in Montreal, Canada, to specialize in pediatric nephrology. Upon completing that fellowship, she returned to Jamaica and she took up a post at the University Hospital of the West Indies as pediatrician and nephrologist. So a nephrologist is a kidney specialist, and she'll tell you more about what she does. She's also an associate lecturer and course coordinator in child health at the University of the West Indies, Mona. And she's currently pursuing further studies, a Master's of Science in Epidemiology. She is passionate about advocacy for health and wellness of Jamaican children. So you know she has your best interest at heart, and she's also an expert in her field. So join me in welcoming our special guest for Ask the Expert Live for this special edition. Please welcome Dr. Rebecca Thomas-Chen. Dr. Thomas-Chen, welcome to Ask the Expert.
Thank you so much. It is an absolute pleasure to be here. So thank you to the Lupus Foundation of Jamaica for inviting me. It really is an honor.
Great. So let's start off, Dr. Thomas-Chen, with what exactly does a pediatric nephrologist do? So tell us about your specialty and what age groups do you care for?
All right. So a pediatric nephrologist is a doctor who did pediatrics, so who is a general pediatrician. That means sees all children between the ages of 0 to 18 years. But additionally, a nephrologist then is one who specializes in the children who have kidney, ureter, bladder disease from a medical perspective. So that could include persons who have lupus that has affected their kidneys, or persons who have just abnormal kidneys from birth, or who develop various diseases of their kidneys along the time while they're going through childhood. We manage them. Sometimes it's just mild. Sometimes it involves things as severe, I would say, or the extreme as dialysis, which does happen in children. But, you know, it's part of just getting children in the best possible health despite whatever challenges arise.
So when when you talk about pediatrics, can you give us the age group? So for those online wondering, should I be seeing an adult specialist or should I be seeing someone like you? What's your age group that you cover, your specialty?
Generally, a pediatric nephrologist manages patients between the ages of 0 years, so as soon as you're born, up to age 18. However, the cutoffs may be a bit different if you're going to the public hospitals in Jamaica, because of various structural issues, probably predating or training. Children up to age 12 are managed generally by pediatricians or pediatric subspecialists, which a nephrologist is one. And then after that, they're transferred over to the adult service. However, I'm currently located at the University Hospital of the West Indies, where we see children up until their 16th birthday and sometimes a little bit over, because we love our babies and we don't ever want them to graduate, really. But generally, once they've turned 16, we're supposed to refer them on to the adult services.
So, this month is Lupus Awareness Month, and it's all about the youth, our focus. And many people don't know that lupus does also affect children. And so I'd like you to start off by telling us how might lupus present in a child or in the youth? What should a parent consider or look out for if they're wondering if this could be happening to their child?
Okay, thank you for that. So some of the presenting symptoms and signs that can occur in a child with lupus are very non-specific. So actually, it can look a lot like many other illnesses. They can have fevers that just come and go without an obvious cause for infection. They can be more tired than usual, so wanting to sleep more or less playful. They can have changes in their appetites. They can have very particular skin rashes or hair loss, which can occur. They can also have joint pains, which may just be pains that you can't see any evidence of on the outside, but it could also involve swelling where you can actually see that something is going on at the joints. And it really can affect all of their organ systems. So though the most common presentations are the fever, the swollen lymph nodes, which some call waxen canal, and the decrease in appetite and activity, it really could extend to being involving everything from the nervous system in the brain all the way down to whatever is in the toes, unfortunately.
So, many of us many of our regular viewers online know about lupus. So we should probably go back to the question of what exactly is lupus for those who may be joining us for the first time or hearing about lupus for the very first time. As you mentioned, all these manifestations, one thing that jumps out is that these things are common things. So children may have joint pains for other reasons other than lupus. But what exactly is lupus? So now that we've got everybody, thinking about the symptoms, they may be asking, what exactly is this lupus?
So lupus is a chronic illness, meaning that it's long-term. Once you're diagnosed with it, you have it for life generally. And it's an autoimmune condition. And that's just a fancy word to say that your body, somehow its immune system, which usually protects us against infections and bad things that are outside of us, starts to recognize the body as being something that it should not be. And so it creates a generalized inflammatory response. So there's basically inflammation as your body's immune system affects the tissues of your body. There is no known definite cause that this is the one thing that causes it. However, there are various associations, such as it can be that there are some genetic links, meaning that it can run into some extent in families. It can be due to certain environmental exposures, such as certain medications, and really can present really diversely. So it's called by some as the disease of 1,000 faces, because it can look like anything else until you have done the further work to test and see that it really has met the criteria. It really can look quite vague.
Okay. So when we talk about lupus, we get the sense that it can affect almost any organ, right, Dr. Thomas-Chen? Well, you're an expert in the kidneys. So the kidneys, you tend to think of, you can pick up joint pains, you can pick up arthritis, but the kidneys are inside the body. how might one know that the kidneys are involved? How might a parent know?
So the sad truth is that sometimes they may not know until it is picked up by the doctor doing tests on the urine when they go for their routine checkups, which a part of your routine child's medical when they're going into school is going to involve them looking at the urine and doing a test on it where they just dip a stick in there and see if there's certain substances there. But what parents may see at home sometimes is that the child's urine may be more frothy than usual. So it kind of looks as though you've put a bit of soap powder in the urine and shaken it up a bit. And so it's a bit more bubbly. And that can reflect the excess urine that is leaking out into the urine that should really stay inside of the body. When the urine protein is sufficiently high, it can cause the child to have swelling, and that swelling can be to the lower limbs, like the legs. It can be all over the body, but sometimes in children, where the swelling shows up the most is really around the face. So puffiness around the eyes and puffiness to the entire face. But the legs really are more common for the adults, the legs and the feet. Those are the most common things that parents would be able to see. It could be also that on their routine medical that the doctor may determine that they have high blood pressure, which can be a part of the association with lupus when it's affecting the kidney. And so that is something that will then trigger further investigation.
You know, I've heard about very special investigations for kidney disease in lupus, which may be a little scary. For instance, a biopsy. Can you tell us about the kidney biopsy and what exactly does that entail, and kind of take away the scare factor from?
The kidney biopsy is done whenever we have a child who has been diagnosed with lupus and we suspect that the kidney may be involved by virtue of having done the test on the urine and the test on the blood pressure. And if we think that there may be something going on, then what we do is basically give a little bit of medication so that the child is a bit sleepy or drowsy so they don't feel the discomfort or the pain. And then they go to get a special study done where usually for children, the specialist who is an interventional radiologist, basically the specialist for x-rays, but they also know how to do very detailed and precise procedures. They take a special needle and with the child laying on their tummy, they use an ultrasound to help guide them, and they're essentially going to stick that needle into an area of the kidneys and get just a teeny piece of tissue. It's really thinner than a needle. It's a really tiny piece of tissue. And then they send that off to the lab, and the lab looks at it, the pathologist, and they're able to say, does this have features that are in keeping with lupus affecting the kidney, or does it not have any features of that? So it is a procedure that, you can be scared of, but usually there are very few side effects in terms of the frequency of side effects. And so it is pretty safe right now to be done in our country and around the world.
Thank you so much, Dr. Rebecca Thomas-Chen. We're going to take a short break because we have to acknowledge our sponsors and tell everyone online what's coming up next in this very special month. Lupus Foundation of Jamaica is a volunteer-run, member-based organization, and we heavily dependent on sponsors. And sponsors have made tonight possible. So we just want to take a short break and acknowledge them and let other people know let people know what else is coming up for this very special month. All right, so our platinum sponsor is Barita Investment. We thank you so much for making this evening possible. This is a very important event in terms of the mandate of the Lupus Foundation of Jamaica to increase the awareness of lupus. And so we definitely have to thank Barita. We just want to highlight that everyone online and everyone who is a part of the foundation, those who are interested in lupus, living with lupus, caring for lupus, you can get involved and make a difference. There's a social media campaign going on. You can join on Facebook, Instagram, Twitter. You can record a video sharing your story, or record a scripted awareness message, share your own message. And every Friday in the month of October, POP, put on purple Fridays. So wear purple on Fridays. Encourage your friends and loved ones and your co-workers to put on a purple. You know, when you're wearing purple, someone will ask you what's going on, and that will increase the awareness of lupus because you can start the conversation. Now we have a children's poster competition that's also going on, and it closes on October 27. And then, of course, please don't forget Laps for Lupus. Laps for Lupus is a major staple of the Lupus Awareness Month events. And it's really fun, super duper fun, where this is what you do. So in your own home, you know, it's COVID-19, get creative, do your laps your way, walk, run, cycle, do a 30-minute workout, log your movements, either using fitness tracking app like Fitbit or Samsung Health, Apple Fitness. You know you are techies out there, many of you. And so what you want to do is then, you know, capture a very short video and share this video. And this video could be 30 seconds or 5 photos highlighting your activity. Submit that video of the laps and screenshots or photos. Send them in by October 17, 12 midnight. And the longest distance in the fastest time or the most creative 30-minute workout video wins. And then you can join for the virtual event on October 17 from 6 to 8 p.m. So you can have fun while raising awareness and funds for the Lupus Foundation of Jamaica. And then, of course, on the 31st of October, we have the annual Lupus Symposium. So this is all going to be virtual. It's a virtual event where we continue to focus on the theme, children and youth with lupus, improving outcomes through knowledge and support. And this is our educational symposium. We'll have scientific presentations by local and international experts. Expert panels will be addressing topical issues relevant to patients and families. And for those who need continuing medical education credits, you can log on and receive those. And of course, it's free to the public. So lots going on in Lupus Awareness Month 2021. And everyone can play their part. So take to social media even now and share this event using the Twitter handle. You can get other people to join. It's not too late. We're going on for an entire hour this month because it's our special Lupus Awareness Month. So I just want to go back to Dr. Rebecca Thomas-Chen and really want to highlight the fact that the disease sometimes isn't recognized early, especially in children. Can you speak a little bit to that while I gather up our questions from our viewers or online, those who are online, those who sent in their questions before? We have the issue is late diagnosis. And can you speak a little bit to that? And when should one seek specialist attention?
Okay, so it is true that late diagnosis really is quite a challenge because one, you have the child suffering for a longer time than is necessary, and two, the longer that lupus goes on untreated properly, there is risk of, long-term damage to various organs that are being affected. So when children present with a bit of fever, a bit of swollen lymph nodes, they perhaps not being as active as they used to be, and especially with having any pains in their joints or skin rash, they should go as soon as possible to their physician. Now, usually, we as pediatricians probably think of something that is common and simple first, and then when those things are ruled out, we test for those things first, and then when those things are ruled out, that's when we start to say, but this fever continues, there's no infection here, what could be causing this? And that usually triggers the doctor to go on to do further testing. I encourage you that if you feel that you are presenting symptoms in your child and they're not being taken as seriously as you would have liked, or they are recurring repeatedly without a clear answer, that you search. As parents, we are advocates for children, and so you ask for a second opinion. You can be respectful and polite about it, but still get that second opinion. because there's going to be a physician there that certainly will go and take that extra step, because the earlier you can catch the inflammatory response action on the various organs, is the earlier you can institute treatment, which helps you to get a better handle on the disease from early.
Thank you so much, Doc. I'm going to go to some questions from our audience. Persons have sent questions in before. Remember, you can type your questions in the chat on Facebook and YouTube. So how about treatment, Dr. Thomas-Chen? What are the options for treatment? And the perception from the questions that are coming in is that, the drugs are dangerous, they're harmful. And so, questions such as, are the drugs, always dangerous, and will they cause harm?
So because lupus is such a very serious illness, and because it can be so severe in the way it affects the body, we do have to use quite high-powered medication in order to control it. So there are medications that I probably would say are less scary in general for persons, and that would be some of the pain and anti-inflammatory medications, as well as there are medications that, funnily enough, are used for treating infections such as malaria, which perhaps the side effects of that are not quite as bad as some of the stronger medication, even though we do have to monitor areas such as the eyes to make sure that no complications are developing. But for the most part, if it is that children are having flares, what is going to help to control those flares is going to be usually steroids. Now, steroids are really strong medications, and we do use them quite commonly in children. However, the doses with which we have to use and the duration in terms of the length of time that we have to expose the children to the steroids really can be of some concern, just because of the side effects of the steroids. But we do try to minimize their exposure to that, and we look at the risks versus the benefits. So for every medication you take, even Panadol or Tylenol, there can be side effects, but we don't think about those so much. We just know that we have pain and we need to get rid of the pain right now. So we can look at it similarly for some of the stronger medications, that yes, these medications can have bad side effects, but if you don't use them, what's lupus going to do to the body? It's worth it to try.
Certainly. I think that probably answers the question that Sharika Patterson asked. I want to take another question related to treatment, Dr. Thomas-Chen. A question that has come up a number of times is, will treatment be lifelong? Can someone get off treatment eventually?
Some parts of the treatment will be lifelong. It is most likely. There are some of the more powerful drugs that usually we use more when you are having the worst flares, the worst, most symptomatic episodes of your lupus. But then sort of to keep your immune system at a level where we think, okay, well, it's a nice balance between it not attacking your body where it shouldn't, but also allowing you to have natural immunity to various infections that you could come across. There are certain baseline medications that we will keep at a low dose for a long time. Similar to how if somebody has high blood pressure or sugar, they do have to take some medications for all their life, but it's a holistic lifestyle. So the more that they eat healthy, try to get as much rest and relaxation as possible, probably is going to help somewhat with the long-term need for the high-powered medication versus just needing to be on that baseline controlling medication.
Okay. On that note of coming off medication, often there is a conflict between, traditional medicine that we've been talking about and alternative medicines. And sometimes it may just be the use of supplements or herbal remedies, and or it may be, a little, diet, for instance, to control lupus, to control inflammation. And the question is it one or the other? And perhaps you can speak to that, because that's a very important question that patients have, parents have, patients with lupus have all the time.
I would say that balance is important in everything. So there is no one size fits all, but you try to live as healthy a lifestyle, or you try for the child to live as healthy a lifestyle as possible. That is going to include making sure that their diet is comprising of lots of fruits and vegetables, and getting adequate amounts of calories and the right type of calories that keep you at optimal level without kind of getting out of control, as well as having a healthy exercise program, so we do recommend that children have at least 30 to 60 minutes of moderate exercise. So they shouldn't be sitting down playing on the tablet or watching the TV all day. You should get them up and say, you may have lupus, but this does not define what you are able to do. And so they should be getting activity that's going to help them to be stronger as well. With the complementary therapies, I would say, such as supplements and various herbal therapies, they do have a role. I would suggest that you speak to your doctor before trying any new herbal therapies, just because some of them may have interactions with the medications that are being prescribed. And so we wouldn't want you to be having an undesirable interaction, which you could have avoided by just staying away from that herb. Supplements are always going to be good, but supplements are something that you take if your diet is not getting enough of what you need to get. So if you're eating as wide of a healthy diet as you can, probably the need for supplements is not quite as much as in a child who is not eating very well and is picky all the time.
Great, Doc. Just want to highlight to those who may be joining us just now that we're doing questions first in this first half that were sent in prior to the show. And then as we amass questions in the chat on YouTube and Facebook, we'll go to those questions. All right. Dr. Thomas-Chen, many people have heard about complicated lupus kidney disease that may require dialysis and also kidney transplant. So many people who follow pop culture will hear about Selena Gomez. And so a question that came in is, if my kidneys are involved, can I just have a transplant like Selena Gomez?
So perhaps the answer to that is going to be very dependent on how badly your kidneys are impacted. So if it's mildly or moderately affected, then because every procedure in medicine, similar to the way before I said that even taking paracetamol or Panadol is going to have its side effects, and so you have to choose when you are taking it. Similarly, though a kidney transplant can be and is life-saving for many who have end-stage kidney disease, meaning that their kidneys are not doing the things that kidneys need to do, which is removing the excess waste and water from the body, as well as providing certain hormones to keep things in balance. So your blood count in the right level, the acidity of your blood in the right level, and keeping your bones nice and strong. If your kidneys are not working to the degree where it cannot do all of that sufficiently, then the waste buildup in your body is going to mean that you would have needed dialysis. In that situation, a transplant is going to be absolutely a great choice. However, if your kidneys are still doing, let's say, 50% of the work that they need to do, the risks that are associated with a transplant, both for you as well as for the person who is donating their kidney, and the fact that we have to consider that after a kidney transplant, you do have to be on very strong medication. You do have to be on a very strict follow-up schedule as well. So those things make us aware that it is not a procedure without its own risks. And so it has to be really taken in context of how bad the kidney disease itself is.
Thank you so much. Can you talk to us a little bit about dialysis? People hear about dialysis and they think if someone ends up on dialysis because they're lupus kidney disease, and as lupus nephritis, in case you've heard that term thrown around, lupus nephritis as kidney disease as disease involving the kidneys due to lupus. If somebody does end up on dialysis, does that mean dialysis for life? Always?
So if you end up on dialysis with lupus kidney disease, it may not be for life. The reason for this is that lupus does manifest with flares. Sometimes flares can attack an organ really aggressively at one point in time. However, if we catch it early enough, which I put again, it's why it's important to continue going to your doctor regularly for monitoring. If we do catch it early enough, sometimes giving very high-powered medication to attack or to fix where the lupus is attacking the body, in this case, the kidneys, sometimes we get nice resolution or improvement in the function of the kidney. It may take days, it may take weeks, it may take months, but not everyone who goes on dialysis has to be on it for life. If it is that the illness has, or the inflammation has affected the kidney to an extreme extent and sort of caused scarring over of a significant portion of the kidneys, then there is a high chance that the child will need dialysis for the rest of their life until they get a transplant.
I see. Okay, can you talk to us about long term? Many people have asked, and this question has come up quite a bit. Will I be able to live a normal life? You've highlighted some of the treatments that some of them may not be a permanent situation, that this disease can come in flares. And we know that lupus is a disease of flares. You can be quiet and then flare up. Young people want to know, will I be able to have a normal life with a disease that can flare up? That's the nature of the disease. It can affect the kidneys. So that's a question. It's a wide open question, but I'll let you handle it how you want to.
Okay. So the answer is not quite so straightforward because we aren't all exactly the same, and the course of our illness may not exactly be the same for every person. So there are, I would say, once persons are being monitored closely and they're receiving their medications, meaning you're taking it every time the doctor prescribes it and not saying, well, I forgot, today wasn't convenient, school was going on, let me skip it for a holiday. If none of those things are going on and pretty much you're trying your best to keep up with your medications, then for the most part, you can live a normal life. Now, normal is going to involve taking some degree of medications, always making sure that you're making healthy choices with your exercise, with your diet, with the stress around you. Those things can all contribute to the quality of life, as well as the way that the rule that lupus has on your body. However, in terms of saying, okay, well, can you do the sports you want to do? Can you study as much as you want to study and become anything you want to do? You are absolutely able to do that. Sometimes, if lupus is affecting a certain area of your body, it may cause you to feel more tired. It may cause your brain to sort of be in a fog. But the good thing is that once you keep up with your doctor, usually a rheumatologist, could be a pediatric or an adult rheumatologist, but once you keep up with your medications, we're quite comfortably able for most persons to ensure that they can live their lives and do whatever they want to do. And their life expectancy really can be quite, comparable to persons who do not have lupus in the vast majority of patients.
So as you talk about living a normal life, they have to always remember that there can be triggers of the disease. So can you tell us about some of the possible triggers and how to avoid them, so that parents will know, the kids will know, teachers online will know to look out for these in students who they know have lupus?
Sure. So again, that is something that will be multi-tiered. So triggers can start from your diet to the amount of stress that's around you. So if you're eating a very inflammatory diet, which tends to be what we call perhaps a Western diet, lots of sugars and lots of red meats in excess, because balancing everything is going to always be the key. Having lots of stress around you, and that doesn't mean you can't study for your test. You still have to study for your test, but you shouldn't put yourself in situations where you're always under great pressure, as well as keeping a healthy lifestyle, taking your medications when you're supposed to take your medications, using sunscreen if it is that you are having or you've been shown to have the skin involved. So that is going to help to protect against some triggers that the sun can cause the skin rash to flare very often. Those are some of the things that a child can do, or that their parent can help them to do, in order to decrease the likelihood of them having flares frequently of their lupus. Some of the times you can't absolutely control it, but you can do your best to decrease the frequency.
So, knowing that there are a number of things that, one has to pay attention to, and children, well, because of the pandemic, children are spending more time at home, but children spend a lot of time at school. Is there anything that parents should share with their teachers specifically about their children who have lupus? Is there anything that teachers and schools need to know in terms of, just day-to-day care of their children? What would be, sort of like the message that that the parents should leave with their teachers?
I would say the message would be that children with lupus can achieve just as much as children without lupus, with some modifications and some flexibility of the school setting as well as their parents. So depending on if they're having active lupus, so having a flare, or just having a quiet time where they're not really having any obvious symptoms, it may be that they may need to go to hospital frequently. They may need to be taking special medications, and those medications may have side effects that can affect the child's ability to function in school temporarily. So we suggest that usually when children are diagnosed, that the doctor can write a little note. They don't have to give all the details about the disease, but just to say to the teacher, this child will need to go to the doctor for checkups. This child may sometimes be admitted. They may need to step out to take their medication at a particular time because, it's very important that you keep as closely as possible to the timing of the medication. And so please facilitate that. If homework needs to be sent home, if there needs to be sort of a peer support, then those things can help to facilitate the normal transitioning through the various school phases despite various flares of the disease.
Thank you for that. As you talk, we think about the psychological aspect of lupus. As someone who is an expert of caring for children, whether they have lupus or not, you have a great understanding of the psychological, aspect of living with a chronic disease, that you have to take medication every day and there's certain things you have to avoid. How does a parent, how does a teacher address the psychological needs of a child, and do other experts in the field come in, need to be involved, and when do they need to be involved?
So the interesting thing about lupus is that lupus itself can affect your mood and how you feel. But additionally, the medications that we use to treat lupus can also affect your mood and how you feel. And then separate and apart from that, just the knowledge of having a chronic illness, that meaning that you're going to need to be monitored for the rest of your life when other children, your friends, are living their normal lives, that can be very, down putting to someone's feelings and emotions, and that is normal. As parents or as friends of children with lupus, the best we can do is to be supportive. And that means helping out where we can, giving a cheering, word. In terms of schools, making accommodations to help them to feel comfortable whenever it is that they do have to be missing. If the teacher can provide the notes that were there that would help the child to feel better and not feel as left out. These children should still be invited to all the parties and all the nice little functions. Don't leave them out because you think their joints might be hurting them. No, they still are able to enjoy things, and that is going to help them to feel as normal as can be. Additionally, if it is that the child is, despite all of these things, still feeling either sad or very anxious, it is always recommended that we seek the support of a psychologist, as well as possibly, if they're teenagers, sometimes an adolescent medicine specialist also helps in relating to the teenager on their specific level and being able to work through all the challenges that they're having now and help them to look forward with hope, but with realism towards what their future may involve.
Thank you so much. And just to mention that we're going to cover these topics and others in greater detail in our annual symposium on October 31. But thank you for touching on that. I want to pick up a question, something which is very topical in this day and age that we live in, Dr. Thomas-Chen. So someone asked, what would happen if I got COVID-19? How would I know it differently from a flare? So just going to talk about a little bit about COVID-19 now, because this is our new normal. So, COVID-19 versus a flare. How would you tell the difference if possible?
Yeah, well, that's a really good question, because a lot of the things that can happen in a flare of lupus are very similar to that which can happen in COVID-19. So it may be that what helps to make the difference is that you know if you were in contact with someone who had COVID-19, or if maybe you slipped a little in keeping your barriers, you know, your mask, that sort of thing. Additionally, some of the features that are associated with COVID-19 are going to be a little bit more acute. They start and you manifest them in a shorter time, whereas sometimes the flares, it's just gradually building up over a longer period of time, not a few days, but probably weeks and months before it's really gotten up to a level where you say, well, I need to go check this out. What can help us to know for sure if it is that they have COVID-19 is really getting a test done. Because the truth is, COVID-19 is a virus, and so all viral illnesses can look the same. And because I told you lupus is the disease of 1,000 faces, that can also look like a viral illness sometimes. So the way to know for sure is if you suspect, you know, that these symptoms could be related to COVID-19, is to have your doctor get a test done, and that will let you know for sure. And that will help us also to decide on what's the best way to treat. Is it going to be to increase your immunosuppressive medication that helps to dampen the immune system, or is it maybe to lighten up and do something else to treat the COVID-19 instead?
Okay. Can I take the vaccine, someone asks, and which one?
You definitely should take the vaccine for the vast majority of patients. And why that is that even though persons are concerned that the vaccines are new and you feel like, well, they haven't been studying it for 20 years. The truth is that the vaccine that they're given is very similar to things that they have been studying in other vaccines for decades. And so it is not entirely uncharted territory. What we do know is that patients who have immune conditions like lupus, or who are taking strong medications to control their immune system, such as the steroids that are given in lupus flares, can lead to someone having a much more severe course of lupus. So you are at a much higher chance as compared to somebody without lupus for being hospitalized, for needing intensive care, and even for dying. And so it is safer to take the vaccine, and many rheumatologist specialists, as well as pediatric specialists worldwide, have been influenced by what the immunologists, which is the doctors who work on the vaccines, have said, and that the recommendation overall is that take the vaccine. Which one? Anyone you can get your hands on first. That's the best one to take.
All right, so moving a little bit ahead of current situation, just another question from our pre-show questions, then we're going to go into our questions in the live chat. You know, these young people are looking ahead, right? And so a question that has come up a number of times is, as we know, lupus affects women disproportionately 9-1. So the question is, will I be able to have children?
The answer to that is yes, generally. So, you know, for most persons, they are able to conceive and to carry to term a baby, which for the most part, or most of the times, the baby is healthy, even though there are situations where there can be exceptions to that, which I can speak about. However, because lupus is an inflammatory condition affecting inflammation anywhere in the body, truthfully, it could also affect your ovaries, which is where the egg needs to come from if you're a girl to make the baby. And it can also affect the testes in men. And those things can possibly, if it is that those specific areas are inflamed, it can possibly decrease the fertility of that person. And when I say fertility, I mean their ability to conceive a child. However, many patients worldwide who have lupus have become pregnant and have been able to carry their babies to full term. And it is just for the doctors to know. And they usually stay on their medication while they're pregnant, because pregnancy can, you know, mess with your hormones a little, and so can increase your risk of having flares during the pregnancy and slightly thereafter. So doctors have to make sure that you stay on your medications, and that after the baby is born, they do checks on the baby just to make sure that there is no complication related to the mommy's lupus.
Okay. Thank you so much, Dr. Rebecca Thomas-Chen. We are going to now look to taking some questions from our live chat. We have spent quite a lot of time. It's been really great information that, has come out of the questions that came before the show. And for those who didn't get to send their questions in, I think now is a great time to hear from you. If you have a question that has been addressed so far during our conversation, then I'll probably skip your question. Otherwise, I'm going to just go into questions that have been posted, which you probably have not touched on. Are you enjoying Ask the Expert Live this month? I hope so. It's still not too late to call someone to join us, right? Okay, so I am looking for questions. All right. Okay, as the questions are coming in, we are going to just put them together, but we're going to take a break now. We're going to take a break now. It's very important that we acknowledge our sponsors. This wouldn't be possible, or neither would the work of the Lupus Foundation be possible without the benevolence of all those people who have been a part of this month's activities, and those who have been with us for the years, since 1984, the Lupus Foundation of Jamaica. So let's hear about our sponsors.
We are very humbled to be among the sponsors for this year's Cancer Awareness Month of activities. With Jamaica having one of the reportedly highest lupus rates worldwide, we recognize that the needs nationally are still so great. So, through the Lupus Foundation of Jamaica, Berita has made a kind donation of $300,000, and it is our hope that this donation will help to make a difference in the lives and the treatment efforts of persons affected by this disease. I have personally seen the impact that a diagnosis can have on the psyche and emotional state of a family, as my own mommy was at some point diagnosed with systemic lupus. The work of the Lupus Foundation of Jamaica is therefore so critical in helping numerous families in finding treatment, obtaining useful literature, and connecting with a supportive community. So, on behalf of the Berita Foundation and our parent company, Berita Investments Limited, I take this opportunity to wish the Lupus Foundation of Jamaica all the very best in your efforts to raise funds in support of treatment for affected persons. And to all affected, hang in there. Remember, God gives his hardest battles to his strongest soldiers. Stay strong.
And there you have it, our sponsors. We thank you so much. We thank you for being on board with us for this month and for being a part of our support network throughout the years. The Lupus Foundation of Jamaica can do nothing without the sponsors, and each and every one of you who participate in some way, shape, or form. So Lupus Foundation of Jamaica is aiming to raise $4 million to keep going. And it's been especially challenging in this COVID-19 era. So we thank you, we salute you. I do so on behalf of all the lupus warriors, and I love that message. All right, we're going to take some questions from the chat, and I'm going to skip some that have been asked already. For instance, Trisha, we have your question about what will happen if you have lupus and about having a child. So thank you so much for that. And Felicia, what vaccine is recommended for the lupus patient? We answered that already, so I hope you're satisfied with the answers. Sandhya Singh says, are there any factors noted that predispose children to lupus? For example, premature babies, Dr. Thomas-Chen. You're the expert on anything to
prematurity by itself, no, does not increase the risk of a baby getting lupus. There are genetic links. So sometimes being the child or the sister or brother of a person who is already known to have lupus does mean that there probably is a higher chance you have some gene that makes you more likely to have lupus, especially if you're exposed to certain environmental triggers. Now, those triggers can be very non-specific. They can just be from a simple viral illness that everybody else could have, or it could be related to specific medication that someone is taking. One additional, more, I would say, rare events that can happen is that if a mother has lupus, if she has the type of lupus where she has specific antibodies against a certain number of things, then those babies of that mother would have perhaps a 25% chance of having something called neonatal lupus, which is when the children, the babies, I would say, manifest as though they are having lupus because of things they get in the blood from their mother during the birth process or during the time of being inside of the mom's belly. However, the good thing is about that is that for the vast majority of babies who do get lupus, neonatal lupus, because of their mother having lupus, they usually grow out of the symptoms, they resolve, and they don't have lupus for the rest of their lives, usually after 3 to 6 months of it. A small percentage will have their hearts affected to the degree where they need to have a pacemaker that helps to make the heart beat regularly, but that really is the minority. And because babies nowadays are being so closely monitored when they're born, usually in a hospital setting, and it's known that their mothers have lupus, so it can be monitored really closely. And so it is not something to be overly concerned about if you really wish to have a child and you do have lupus.
Thank you. So Kadisha Banks says, in terms of a healthy diet, what are the foods you should stay away from? I know we touched a little bit on diet about having a balanced diet, and you mentioned the Western diet, which is, tends to be inflammatory, but sometimes patients hear different messages, like specific things. Are there any specific things that you know of that patients with lupus should stay away from?
I think balance and moderation is good for everything. And so to say specific substances, then perhaps no. A little bit of most things is going to be completely fine once it is being taken in moderation. However, people who do have lupus, especially if you're on medication such as the steroids, you have a higher risk of having things such as high blood pressure and diabetes related to the steroid use. And those steroids are great medications, and so they really are helping us do things that we couldn't do otherwise very well without them. Because of that increased risk, it is, I would say the general making sure you have sufficient fruits and vegetables and protein in the diet, not too much, but just the right amount, which is different based on the age and stage the child is at, as well as ensuring that not too much sugary drinks in terms of with the high blood pressure risks, not taking in too much salt. So a good idea in terms of how much salt, is too much salt, is that we sometimes say you can cook with a little bit of salt for everything, but when the food comes to the table, perhaps don't add any more salt. Perhaps it's all right. And sometimes you may not like the taste of it at first, but you can, your palate does get used to things after a while. So that's what I would say is recommended generally in terms of dietary intake.
Okay, just on that note of diet, Dr. Thomas-Chen, someone asked specifically about soy. And soy is often controversial. So can you speak a little bit about it? You spoke about balance. So somebody really wanted to know, should they avoid all dairy and soy products? They're using almond milk now. They were told to avoid almond milk as well. What should they use now? So diet is always, lots of questions on diet usually. Mm-hmm. So we know soy does have some estrogen component, and we know estrogen can make lupus activity worse. And so it's generally recommended you avoid, as you said, everything in moderation. So I'll just jump in and answer that. And in light of you not taking dairy, supplements, right, Dr. Thomas-Chen, calcium, vitamin D, we know we tell our patients to stay out of the sun, so vitamin D supplementation is important. It can also help inflammation. So just to answer that, we have a question about sort of forward looking. Someone asks, how long can someone live with lupus?
Someone can live the life expectancy of someone with lupus. So it really, in 85 to 90% of persons who have lupus, that is followed up they're taking their medications, and they're being followed up closely by their physicians, life expectancy is normal for the majority of patients. However, it is true that there are times when you can have really severe flares that, despite, treatments, can lead to permanent damage in various organs, and that can increase your risk of not having a normal lifespan. So generally, I'm a nephrologist, and sometimes we do have to do dialysis. The truth is that children who do have to have kidney dialysis don't have the same life expectancy as others who do not ever have to go on dialysis. Persons who have uncontrolled high blood pressure, persons who have very bad heart inflammation related to the lupus, if those things are not treated before they get to a very severe level, then sometimes just the damage that's left in that organ, even after the lupus is kind of under control, can decrease the life expectancy. And so again, I reiterate, it's very important to make sure you're keeping up with your appointments, you're taking your medication as best as possible. Everybody slips up sometimes, but try to jump back on the ship as quickly as possible.
So thanks for that, because I think you answered Trisha's question. Trisha Smith was asking, what if you miss your medication? So I think we answered that too. I'm just looking forward at just lupus and living with lupus and increasing awareness, because that's what this month is about. Sometimes, patients living with lupus, even, children, people will approach them with different ideas and concepts about lupus, which are wrong. So there are a number of myths. I'm going to throw them out to you and you just bat them away really quickly. Okay, lupus is cancer.
Not.
Okay.
It is. You go ahead.
Cancer. Okay, lupus is something like HIV.
No, and it's not contagious. You can't get it from your friend.
So you batted away my third question. Lupus is contagious. You're going to get it from your friend at school.
Absolutely not.
Okay. All right. So lupus is a death sentence. Lupus means you're going to die. Bad news spreads fast, right? So we tend to always hear about the bad cases about lupus. But as you and I know, we have a wide spectrum. We have people who don't have any symptoms at all for many, many years, going to school, living their life, becoming, all they can be. So lupus is a death sentence. Let's speak to that.
That is absolutely not so. As you said, a spectrum, and many, many persons, especially if it is that you're getting your close monitoring and you are taking that little, medication that helps to just keep everything under control. Generally, normal lifespan, you can exceed all expectations and you can do excellently in your life.
So Dr. Thomas-Chen, a part of what we do as doctors is not just give a prescription. We sit and we hear and we listen and we address all of the things that are not written on a prescription. Can you speak a little bit to just sort of speak to that mom, that child who's living with lupus, as someone who's seen so much lupus, what is your message of encouragement to them?
I would say that you may have lupus, but lupus doesn't have you. It doesn't define who you are. It is something that your body is afflicted with, but you are so much more than just your body. You have a beautiful mind, you have a soul, and no matter what lupus does, you can still rise above that. So if you are the loved one of somebody who has lupus, or you yourself have lupus, I think focus on having interest so that there is balance in your life. You're not just focused on, oh my gosh, there is illness, this is the end of everything. No. Develop things that you are interested in, things that you focus on, have as many friends as you can, so that, it's when those things help to decrease your stress levels as well, which are triggers for flares of lupus. And additionally, leading a normal life in every way possible is also going to help you to have less mental anxiety about what lupus can cause. And so whatever comes along the way, that it's okay. You have your support group, because lupus doesn't have you.
Awesome. I think that's a great way to end. I want to thank you so much, Dr. Rebecca Thomas-Chen, for spending a whole hour with us on this special edition of Ask the Expert Live. You are awesome. We, tackled a lot, but I just want to let everyone know that, coming up of our upcoming symposium, October 31, we'll be taking on these topics, and you'll be hearing more, and you have opportunities to ask more of your questions. So it doesn't end here. And thank you so much for also being a great audience, for participating, sending in all your questions before, sending your questions during the program, sharing on all our social media platforms. So just really want to thank you, Dr. Chen, Thomas-Chen. Now, if anybody wants to find you, how can they find you? Because, they probably fell in love with you.
Well, first of all, thank you so much for having me. You've been a wonderful host. You've helped me all the way through not to be nervous, and I appreciate that. And thank you again to the Lupus Foundation of Jamaica for inviting me to be here. I can be found that we have a pediatric nephrology clinic for children at the University Hospital of the West Indies. So that's where I'm based. And so if your child has lupus and you're not currently being followed up, or you're looking for somewhere, just know that we're there, and we're happy to see you, and we're happy to bring you in to be one of the family.
Thank you so much, and thank you for your advocacy, and thank you for being a champion and a voice for children and young people, not just those living with lupus. Thank you so much. So we're coming to the end of a great session, and really want to thank everyone for joining us online this evening. And as we go, I just want to highlight that it isn't over until it's over, when the month is actually over. It's Lupus Awareness Month. It's children and youth with lupus, saving lives through knowledge and support. So get involved. We have a social media campaign, Facebook, Instagram, Twitter, LinkedIn, TikTok. I don't know much about TikTok, but I'm sure many of you do. You millennials, you young people, you TikTok. Record a video, put on purple on Fridays, every Friday in October. We have our children's poster competition, and we have laps for lupus. So get done in your purple outfit, do those laps, those steps, walk, record a 30-second video, or send us 5, selfies. You're taking selfies all the time, so take selfies during this. And you can send them in, and then we'll have our virtual event Sunday, October 17th, to end that week, this time of Laps with Lupus. It's October 17 at 4 to 6 p.m. You can just put that on your diary. It's going to be a lot of fun. And of course, our annual symposium is on Sunday, October 31. And you can register on lupusfoundationjamaica.org. And you can expect to hear many more from many more speakers, both local and international, on this topic to do with youth. And we'll also have roundtable discussions. And so, there is still lots more to come. So join the fight, donate. You can go on Lupus Foundation of Jamaica and donate. Remember that this is a volunteer-run, member-based organization. It's totally dependent on you giving and you sharing, sponsorship, your time. You don't have money, your time. And of course you can visit the Lupus Foundation of Jamaica, let them know that you're coming. You can collect posters, pamphlets. Sometimes you may not be able to explain yourself, but you can pass a pamphlet on to the teacher, a pamphlet on to your neighbor, your co-worker. That will help them to understand that what lupus is about, because sometimes it's hard to explain. But lots of videos also on YouTube from the Lupus Foundation of Jamaica that will help you to explain, to put the proper words to this disease. So we thank you so much. So go to the website now and register for the events that we have ongoing and for the upcoming events. We thank you so much. It's been a great program, Ask the Expert Live. We do this every month. For those who it's their first time, it's done every month. It's usually half an hour, but this month's the big month, so we had 1 hour with a special guest, Tanisha McGee. And I want to thank you so much for all that you do for persons living with lupus. So we see you at Laps for Lupus Awareness. That's our next live event. God bless you. Take care.